The daily report released by the Ministry of Health on the positive cases of COVID-19 is only a snapshot of the data being collected and monitored by our health officials. The numbers released show how many people tested positive for the given day and the total number of tests conducted. But these numbers change daily and only give us a momentary glimpse as to how we're doing battling this pandemic. An epidemiologist with the Ministry of Health, Antonio Agar, helps us to put all this data into perspective.
Where we stand as of yesterday, which is the end of September. Okay, so just a brief recap. The current wave or phase that we entered into began on the 1st of August. That is when we actually detected the cluster that was in San Pedro. Of course, we believe that it was circulating before then, but the 1st of August is when we actually made the formal confirmation of that. Mm-hmm. And then since then, this graph basically shows the raw numbers of positives that we have detected on a daily basis, broken down by weekly segments, as you can see at the bottom. And as you can see, so we started off slowly, did our case investigations, found quite a number of new cases that correspond to actual waves, and I'm going to get into that in a while. And that brings us to where we are here up to yesterday, when there was a total of 49 confirmed positives as of the 30th of September, which is yesterday.
You can see in this current outbreak that just in the past 61 days, there have been fluctuations, peaks and valleys in the total cases recorded. Another way of monitoring the trend is to look at the rolling average of cases.
And this isn't something that's necessarily unique to Belize or Belize's data. If you check the way that positives are reported in many other countries around the world, it's a similar trend, and there's many reasons for that. It could be that they just sent out more contact tracers that one particular day. Mm-hmm. It could be that they found a brand new cluster where there was a lot of people who were positive, maybe working at a factory, maybe working at the business, mm-hmm. where people were in close contact with one another. It could be that there's a whole community that they found that was not investigated before that was positive. So there's many reasons why you could have a spike one day and a relative low number of cases the next. So one of the ways that we actually make sense of this as epidemiologists and people working in public health is to, like I said, find the average of a certain cluster of days so that you could basically see how many new people are being found positive on an average of a given day, as opposed to on single days where it varies so widely.
And just as Agar noted, the picture becomes clearer as we look at the 3-day rolling average.
The numbers are still peaking on certain days and going down on others, but it's a much less pronounced peak and valley as compared to when you're looking at the raw numbers. And again, that's because of the action of actually finding the averages. And if you follow the orange line, that's actually showing you the general trend. So you can see here, and you'll see it even more clearly when I show you the 7-day average. We have had too many outbreaks or too many waves since the beginning of this new phase that we entered into at the beginning of August. So there was that first wave that basically began at the beginning of August, and for about a 2-week period, starting from around the 6th of September all the way up until about the 21st, which was just around the corner just the other day, we actually saw a downward trend. Mm-hmm. So, things were slowly decreasing in terms of the number of positives that we were finding. But since then, as happens again in many countries around the world, there tends to be complacency when the data is looking good for a consistent amount of time. People start to feel like things are under control, and people begin to basically go about their lives as normal when they really shouldn't. And basically, we have what we have now, which is now a third mini wave that we're now experiencing here in the country.
The 2 previous waves and the current wave that we're entering are more apparent when Agar shows us the 7-day or weekly rolling average. Another number that epidemiologists closely monitor is the reproduction rate, or what is called the R0. Simply put, this is the average number of people that one positive person will infect.
you can see that our current R naught is actually above 2. It's actually roughly 2.5, more or less.
Mhm.
And that is basically telling us that as of yesterday, the 30th of September, on average, whenever a person becomes positive with COVID-19 here in Belize, they then go ahead to spread it to 2.5 other people. And obviously, this will vary greatly on an individual level. You'll have people who will comply and stay home and not infect anyone. And then you have people who go out there, maybe unknowingly in some cases. And like I said, don't follow the proper social distancing protocols or don't wear the mask properly all the time or in the proper way. And they could spread to unknown numbers of people.
Now, an R naught of 2.5, or imagining myself infecting two more people, 2 to 3 more people, it doesn't sound like that much. Is that a concerning number for the country?
It is because when you're looking at a number like that, you're looking at basically exponential growth for a certain amount of time. So basically, right, if it were a case that this was a disease that was highly, or that was better contained, then infecting 2 or 3 more people might not sound like a lot. But then when you begin to multiply that and consider that each of those 2 or 3 persons then go on to infect 2 or 3 new persons, then you can quickly see how it basically multiplies on an exponential scale, until the point that most people in the community are actually infected.
Now, this is the picture of the country's overall average. The reproduction rate is higher in some of the hotspot communities and lower in areas with no community spread. Even so, the goal is for the country to have an overall average reproduction rate of less than 1, where all new positives only infect 1 or, more preferably, none. This is why Agar joins his colleagues in pleading for continued vigilance and prevention practices.
The numbers, while useful, are basically still capturing a fraction of the true positives, and basically, that makes it even more important for people to adhere to the social distancing measures, the mask wearing, and all of the other health and hygiene practices that are recommended.